Hi, Sue Gray, lawyer with a background in biochemistry, microbiology and risk management, and I'm here to do an update on this very divisive legislation dividing families, employees all around New Zealand. Is it a case that this new legislation, no jab, no job, is actually worse than the disease that the legislation is designed to protect against? It's causing mental stress around the country. People are losing their jobs. It's dividing families, those members that have read the fine print and those who have simply accepted what the government spin has been. There have been so many problems that I've identified that I've decided it might be useful to do a bit of a fuller explanation of some of these issues so that you can be better informed and help make better decisions for yourself and your family. And what this law means is if you work in one of the specified jobs, including at the ports or on international flights or in some of the government jobs working near the ports, you are required now by law to have a vaccination for COVID or you can't go to work. And you can be fined if you haven't had a vaccination, $300. Your employer can be fined. The fines are up to $1,000. There's a breach of your privacy because the government's entitled to ask your employer for your vaccination records. This law is an enormous change away from our normal human rights and our normal rights as citizens over our own bodies. It's always been accepted that medical treatment is discretionary. It's never up to somebody else to say you must have medical treatment. But it's even more serious here because this vaccine is only experimental. It only has provisional consent in New Zealand, which is approval only for treatment of a limited number of patients. And that's the question that we've asked the High Court to look at in the urgent hearing on the 12th of May. But in the meantime, the government knows that the vaccine does not have full approval, and indeed it can't get full approval because the clinical trials aren't complete until 2023. So it doesn't qualify for full consent. All it has is this provisional consent for basically an emergency use because of the severity of a risk, and it can only be used for the treatment of a limited number of patients. So we have this idea that this vaccine that's causing a large number of serious effects all around the world, and we're now starting to hear reports of sudden deaths after the vaccine in New Zealand and all sorts of strokes, blood clotting issues and other concerns. This vaccine that would never pass normal safety testing is compulsory for anyone who works in these jobs. And not only that, if you look at the safety data sheet of the vaccine, there's a number of areas where it's not recommended for use and where there's been no testing. So if you're pregnant or breastfeeding, if you're using other medications, if you've got blood coagulation problems, if you've had another vaccine, all sorts of things haven't been tested in conjunction with this vaccine, and indeed it hasn't been tested with other vaccines. So there's a lot of health and safety risks from having the vaccine. Now, what is the benefit of having this vaccine? And that's a very good question because the government themselves have said they don't know if it prevents infection and they don't know if it prevents transmission. So at the start of their media campaign, they were trying to tell us we were letting the community down if we didn't have the vaccine. They've changed their messaging because they couldn't sustain that message. They've changed it to basically say, look, we're requiring you to have this vaccine to protect yourself. So they're requiring you to have an experimental vaccine to protect yourself from the so-called COVID that isn't in New Zealand, and that most people who have it, and particularly healthy young people, working people, the type of people that are working at our ports and aircraft, will recover without any side effects at all. So that's why I say it's extremely draconian legislation. The government seems to have thrown out the baby with the bathwater. They've thrown out all of our normal laws, all of our normal protections. They've thrown out best medical practice, including informed consent, and they've brought in a law that has no rational basis. In the meantime, what are the consequences? People, healthy, fit people, are losing their work, and it started already. People are being told, don't come to work tomorrow if you can't prove you've been vaccinated. Now think about the implications of that. What is happening to those families? What income are they going to have? What is the harm from a worker who might have worked in their job 5, 10 or more years, suddenly not having a job tomorrow, compared to the hypothetical risk that if they don't have this vaccine, they may get sick from COVID? I mean, there's just, in my eyes, no possible way of justifying the law itself or the consequences of the law. And the further you dig into this, the more concerning it gets, because they've added these jobs at the back just with a notice on the back. Presumably they feel that they can add extra jobs on the back at their whim. Now that is not how the law is supposed to work, and that is why I'm so concerned about what is happening here. As members of the public, what can you do? Well, you can make very clear to the government that you don't like their invasion into our privacy, into our body sovereignty, and you don't like them interfering with health and safety, with employment agreements. If you work in that field, you may like to arrange meetings with your own team there and talk about how you want to respond to that. If people stand together, they have so much more power than if they're divided and conquered. Just imagine if a group of wharf workers decide that actually we're not prepared to stand up to this. Instead, we're going to say, no, we're not going to work under that sort of dictate from our government. If our workers do stand up, they actually can take back their power. They can stand up and they can say, no, we're responsible for our own body sovereignty. Leave it to us to decide what's good to us. And it's a decision that should be made by us and our doctor, not by our government and not by untrained vaccinators who have a 2 or 4 hour online training course and sometimes no medical training at all. So it's time, in my view, to stop and ask the really, really hard questions that our government hasn't been asking, or if they have been asking, they've been very secretive about what they've been asking. It's time for us to step up and say, hey, we live here. You, government, represent us. It's not for you to impose these irrational and extremist rules on us. Let's have a community conversation about this. Let's take a pause and let's get some logic, some principles, some law, some human rights, and some good medical practice back into this, and let's start again. One of my main concerns about this pressure on people to get vaccinated is the poor informed consent. Now, informed consent requires full and frank understanding of the information, and also freedom of choice over whether you do what you're asked to do or not, because if you don't have freedom of choice, if it's done under duress or threat of loss of employment, it can't be informed consent. So that side of it now is obviously not informed consent. There's no choice. If you have to choose between your job and the vaccine, otherwise there's no choice. But the other side of this is the misinformation, and the misinformation is really concerning to me, because the government has put out a very powerful propaganda campaign claiming things like safe and effective and MedSafe approval. Now, unfortunately, that is not true. And I can very safely say those claims are not true, because when you look at the fine print in the government's own documents, it's very clear that the vaccine is not safe and it's not effective and it doesn't have MedSafe approval. Now, some of the commentators have tried to say, oh, but we can assume it's safe because it's been tested around the world. The very fact that they're saying it's being tested on communities around the world is actually a breach of the Nuremberg Code and a breach of our New Zealand Bill of Rights Act. You cannot test a medicine on members of the public. You need their informed consent that they're part of a test. So that's what's gone wrong in this process. What should have happened is all of this testing should have been done before the vaccine was rolled out to the public. But because of the way this process has been rushed through, the normal clinical trials don't finish until 2023. So effectively, everybody who's having the vaccine up until 2023, when the trials are finished and reported on, is part of an experiment. And the experiment is only as good as the controls and as the data that's collected. So we know that there have been a large number of sudden deaths and serious injuries after people have had the vaccine. Now, if you're doing an experiment, you need to have very, very good ways of collecting, recording all of that information of every adverse effect and analysing it. Now, that is not happening. We know that a nurse died at Palmerston North Hospital on the 23rd of April within a couple of days of having a vaccine. We know that people have died after having vaccines from Port Motueka. We know that a woman from the county's Manukau Health Board, who was one of the promoters of the vaccine program, died the day she had the vaccine. What we don't know is the exact link between the vaccine and their deaths. But these are all very important cases that need to be urgently identified. All of them, these are just the ones that people have referred to me. I'm sure there's a large number of other cases that are being talked about in social media. I know there are a lot of people that have been hospitalised after the vaccine, but those cases are not getting onto the register of adverse effects for New Zealand. And where they are getting onto the register, example, the case of Jane up in Whangarei, they may be reported to the register, but they're not coming out the other end as an adverse effect that's been accepted as being linked to the vaccine, even though the doctors at the time said it was linked. So if we are going to call this an ongoing experiment, and we are going to rely on the number of deaths and injuries following the vaccine, we have to actually do it properly as an experiment. We can't have the best of both worlds. With the COVID case, anyone who died within 28 days of a positive COVID test, even if they had absolutely no symptoms of COVID, was treated as a COVID death. Now, if we're going to be consistent, we should be using the same criteria with the vaccine. Anyone who dies within 28 days of the vaccine should be treated as a vaccine death, or at least prima facie as a vaccine death. And then if it's obvious that there's some other reason that caused it, well, that's fine, let's remove them from the list. But we need to get all of the data so that people can make informed decisions about whether the vaccine is right for them or not. And this issue about medical medications that you're on, how is your body affected if, say, you're on statins and then you have the vaccine? So you may already have some sort of blood clotting issues. What is a vaccine that's known to trigger blood clots going to do for you? And what are your risks if you don't have the vaccine? What are your risks if you do have the vaccine? First of all, you need to know that when you turn up for a vaccine, that there may be a risk, and you need to know that this is something important that you need to talk about with the vaccinator or your doctor before you get the risk. What's happening is the opposite. People are being told, you need to turn up at 10:30 today, get your vaccine. They arrive at the station. There are these partially trained vaccinators who don't have medical qualifications often, and who certainly don't have access to the patient's medical records. So they're asking someone to say that they understand the risks when none of the risks have been pointed out to them. It's next to useless having a consent form where there's clearly no discussion about the risks, and the person is unqualified to identify the risks themselves, and they've been misled by this campaign by the government claiming it's safe when the evidence is definitely to the contrary. So there's so many of these risks, and it's a bit of a multiplier effect when you've got an experimental vaccine that's only gone partway through the trials, and it's being rolled out on the entire population, and it's being rolled out by vaccinators who don't have medical training and who don't have access to the medical records, and who don't know what medication someone is on that may or may not affect their reaction to the vaccine. And then there's no documentation following up any of this. People aren't being rung, 12 hours later and saying, how are you feeling? Have you had any effects? Have you got, sore arm or whatever? Or, oh gosh, you're in hospital. Why are you in hospital? Or gosh, the person's died. Why did they die? There's none of this follow-up that needs to be done if we're going to say, actually, it's all just a big experiment. So this multiplier of lax practice, not best practice, is putting our communities at risk, and it's undermining our laws, it's undermining our freedoms, it's undermining our employment rights, it's undermining actually our medicine and our trust in medicine, and it's undermining our trust in government, because they are failing to do their job and act responsibly and act in our best interests. There's so many problems here.